Hello, my name is Amber LaRock and I am a staff writer with Emergency Vets USA as well as a licensed veterinary technician. Our goal at Emergency Vets USA is to educate you on topics regarding your pet's health. So foxtails are a silent danger that every pet owner should be aware of, no matter where you are located across the country. Foxtails refer to a plant that releases barbed seeds when it blooms, and these seeds are known for getting stuck in your dog's fur and will then continue to burrow into their skin until they cause significant complications for the dog affected. Foxtails will not stop until they are stopped, so this means that until you remove the foxtail from your dog's body, it will continue to burrow further and further into the tissue no matter which route it entered the body. What typically happens when a dog comes in contact with a foxtail is that the foxtail will make direct contact with the fur or the skin, and they will be pushed inward just through normal body movement. For example, if a dog steps on a foxtail, even if it's just on the corner of their paw, what will happen is the dog will keep stepping on the ground, moving their foot, and the normal action of the muscles moving and hitting the ground will burrow the foxtail deeper into the skin. And once this happens, that foxtail will keep moving further and further inward. Because of this, not only are they just outright destructive to the tissue, but they also leave a path behind them that can fill with bacteria and lead to infection. Foxtails are also dangerous due to the fact that they can make contact with vital organs. Some foxtails will burrow deep into the abdominal cavity where a lot of vital organs are present. Foxtails can also burrow into the lungs and lead to a life-threatening lung infection. Because a foxtail can enter your dog's body in different areas, this means that you can expect different forms of symptoms. So if a foxtail enters your dog's paw, you may notice them licking the paw. They may be limping. You may notice swelling or redness of the paw. If a dog has a foxtail in their nasal cavity or anywhere around their nose and eyes, you may notice the dog pawing at their face. They may be sneezing. They may have nasal discharge. If a foxtail enters your dog's ear, you may notice them again pawing at the face or even shaking their head violently. If your dog does have a foxtail injury, the only way to treat this foxtail injury is by removing the foxtail. This is typically done under general anesthesia, no matter where the foxtail is located, because this is typically very painful, and a lot of times it will lead to a localized infection, which your veterinarian needs to treat. So for example, if your dog has a foxtail that is embedded deeply into their paw, your veterinarian will typically place your dog under general anesthesia. They will remove the foxtail with special tools, and they will thoroughly flush the area to rid the area of any infection, and then also search for any damage that is present. Once your dog is awake and recovered from anesthesia, your vet can send your dog home with antibiotics and pain control for the next 7 to 14 days based on the severity of their case. Then your dog is typically just fine and they can return to their normal lives. Treatment for a foxtail injury can of course vary. For example, if a dog has a foxtail injury in their lung or any other vital area, of course treatment will be more aggressive. So we always suggest just trusting your veterinarian's guidance when it comes to your dog situation. They're the only ones that will know how to manage your dog's case specifically. For a more in-depth review on foxtails and foxtail injuries in dogs, be sure to refer to the article that is attached to this video, but stay tuned to Emergency Vets USA for more topics on pet health.